Welcome to our in-depth exploration of weight gain and obesity, a growing concern impacting millions worldwide. Today, we unravel the complex factors contributing to weight gain and delve into its significant health implications, offering effective strategies for management and prevention. Weight gain can be attributed to various causes. Dietary habits play a pivotal role, with high calorie intake, excessive sugar and fat consumption, and low nutrient density leading the way. Coupled with a sedentary lifestyle, where physical inactivity curtails calorie expenditure, these factors contribute heavily to weight gain. Genetics also play a part, influencing metabolism and fat storage, while medical conditions like hormonal imbalances, such as hypothyroidism or insulin resistance, further complicate weight regulation. The health risks associated with excessive weight are profound. Obesity significantly elevates the risk of cardiovascular diseases, diabetes, joint problems, and mental health disorders such as depression. These conditions not only diminish quality of life, but also pose serious long-term health threats. However, there are solutions and strategies available to combat these challenges. Lifestyle modifications are fundamental, encompassing a balanced diet and regular exercise to maintain calorie balance. Behavioral changes, such as mindful eating and portion control, are equally vital. In certain cases, medical interventions, including medications that suppress appetite or reduce fat absorption, may be necessary, though these require careful medical oversight due to potential side effects. For severe obesity, surgical options like gastric bypass surgery can offer a viable solution. Psychological counseling can also provide essential support by addressing emotional factors influencing eating habits. Prevention remains key, emphasizing early intervention through education on healthy lifestyles and regular health screenings. Public health initiatives play a crucial role, fostering community awareness and improving access to nutritious food options. Ultimately, addressing weight gain requires a comprehensive approach, blending diet, exercise, medical management, and psychological support to achieve sustainable weight loss and enhance overall health. Together, we can work towards a healthier future for all.